Occupational fatigue is an increasingly dangerous, yet commonly overlooked health condition that affects a majority of the workforce. Because it's so common, people may think of it as a normal part of working and underestimate the effects. They think, everybody's tired, what's the big deal? But there's more to workplace fatigue than just being tired. Consider the facts. More than 69% of workers feel fatigued at work. Fatigue, which can be either acute or chronic, can not only reduce productivity, it affects safety as well. Losing even 2 hours of sleep is similar to the effect of having 3 beers. According to numerous studies, being awake for long periods of time is akin to being inebriated. Staying awake for 17 hours is equivalent to having a blood alcohol content, BAC, of 0.05. Staying awake for 21 hours is equivalent to having a BAC of 0.08. Staying awake for 24 hours is equivalent to having a BAC of 0.10. Fatigued people are 3 times more likely to be in a car crash. Just like when a person is intoxicated, the effects of being fatigued include reduced reaction times, ability to pay attention, and awareness of hazards. In fact, motor vehicle crashes are the leading cause of work fatalities. The American Sleep Foundation statistics indicate 60% of adult drivers, or 168 million people, reported driving while feeling drowsy. 37%, or 103 million people, have fallen asleep while driving. 13% of adult drivers confess to driving while drowsy at least once per month. 4%, or 11 million people, had or almost had an accident due to fatigued driving. 59% of night shift workers sleep less than 7 hours a day. Night shift workers are at a higher risk of developing occupational fatigue because they tend to sleep less than day workers. Our body has a circadian rhythm which tells us when to sleep and when to be awake. Night shift workers have a hard time getting more quality sleep because they're trying to override their natural sleeping pattern. Employees working irregular shifts are even more vulnerable since their body clocks can't adapt to the changing sleep schedule. The risk of injury on night shifts is 30% higher than day shifts. Fatigue-related safety risks peak during night shifts, particularly between 2 a.m. and 6 a.m. The risk of injury on the night shift further increases as fatigued workers increase their sleep debt, going up to 36% higher on the 4th consecutive night shift. Sleep debt is the cumulative effect of regular lack of sleep. For example, after losing 2 hours of sleep every day for 10 days, your performance on the 11th day will be as if you didn't have any sleep at all. 97% of fatigued workers have reduced cognitive performance. When people are affected by occupational fatigue, their cognitive abilities go down. This leads to poorer performance in terms of attention, vigilance, and memory. Fatigued workers also tend to make more errors and become less productive. In industries where clear thinking is a necessity for safety, workplace fatigue can lead to accidents and even fatalities. Workers with sleep problems are 1.62 times more likely to get injured than workers with no sleep issues. About 40 million Americans suffer from chronic long-term sleep disorders. An additional 20 million people experience occasional sleep problems. Chronic fatigue syndrome is most common in the 40 to 60 age group, which is over 33% of the working population. CFS is more common in women than men, and among races, most common in white people. Though it can affect people of all ages, including children, it is most often diagnosed in adults aged 40 to 60. This age group comprises more than 1/3 of the U.S. labor force. Currently, there are no specific laboratory tests that can be used in directly diagnosing CFS. Also, there is no known cure for this illness, though there are some ways to manage its symptoms. Overwhelming workplace fatigue. Experts say effectively combating workplace fatigue requires changes in both the personal lives of employees plus good workplace policies. Some recommendations include: avoid stimulants like caffeine and energy drinks. They may give you a quick boost, but make you more tired in the long run. Prepare for sleep. Avoid using your computer or cell phones 1 to 2 hours prior to sleeping. Go to bed at a consistent and regular time, even on off days and weekends. This way, your body can become accustomed to your required sleep patterns. Create a healthy sleep environment, which includes a good mattress, a quiet room with dark blinds, and earplugs. Stay hydrated. Drinking adequate amount of water daily has been shown to have a major effect on brain function and energy levels. Move often. Frequent movements encourage blood circulation and helps ward off fatigue. Incorporate ergonomic exercises every few hours that can be performed right at your desk or workstation. Eat smarter. Food is the fuel to our bodies, and what you put in directly affects your output. Avoid overeating and foods in high artificial sugars. Pick fruits and high-energy snacks instead. Talk with coworkers about their sleep strategies and challenges to come up with additional ideas that may work for you. Fatigue. It's a fact of life. In fact, in today's work environment, it can be hard to avoid. But that doesn't mean there aren't things you can do to minimize it or reduce its effects. There are. But only you can decide to take charge and get the rest you need and live your best life. Workplace fatigue is a problem that affects both productivity and safety. For this reason, management needs to do what they can to help reduce fatigue. In doing so, productivity goes up and injuries go down. Who doesn't want that? Now, we know that you may not be able to implement or accomplish all of the ideas we present in this segment, but it's definitely food for thought to get you on the right path. Fatigued workers lose 5.6 hours of productive time per week. Aside from safety, another side effect of occupational fatigue is poor productivity. Because of reduced cognitive performance, fatigued workers find it hard to concentrate and need more time to complete their tasks. Healthy workers only have a productivity loss of 26%. On the other hand, fatigued workers have a 66% rate of lost productivity due to cognitive decline and inability to focus. Fatigue costs employers about $136 billion a year in health-related lost productivity. There are two ways that occupational fatigue leads to health-related productivity loss. Absenteeism. Workers who are in poor health tend to take more time off from work to consult their doctors and get some time to recuperate. But once they return to work, they are once again exposed to the factors that can lead to occupational fatigue, making it a continuous cycle. Presenteeism. These are fatigued workers who are present at work, but are not able to perform well because of health reasons. Interestingly, out of the $136 billion spent on lost productivity, 84% is due to presenteeism rather than absenteeism, according to the statistics. 12. The cost of fatigue is approximately $80 million per year for an average-sized company with 52,000 employees. It is estimated that a company with 1,000 workers lose $1.4 million a year due to occupational fatigue. This is the combined cost of absenteeism, presenteeism, healthcare costs, occupational costs, and accidents. On top of the financial loss, the fatigue cost calculator can also identify how much savings a company can get from implementing a sleep health education program that targets untreated sleep disorders. For example, an average-sized company can save up to $40 million in a year if 50% of their labor force participates in a sleep health program. Up to 2.5 million Americans are estimated to have chronic fatigue syndrome. Based on the 2015 report of the Institute of Medicine, IOM, up to 2.5 million people in the U.S. are afflicted with chronic fatigue syndrome, CFS, with 90% of these cases left undiagnosed. Compared to acute fatigue, which can be resolved with enough rest and relaxation, CFS is a disabling and long-term illness that doesn't get better with rest. It is an illness that is often misunderstood and undiagnosed because of the lack of awareness in both the patient and doctor's part. First, it's important to be able to recognize the symptoms of fatigue. Occupational fatigue usually play out in the following order: First, the fatigued worker will experience decreased cognitive performance. Microsleeps or nodding off starts to occur as the body uncontrollably tries to get some sleep. An engaged supervisor should recognize these symptoms and intervene before there is a safety issue. An open atmosphere that fosters two-way communication can help identify potential issues and help implement solutions. Remember, employees may be hesitant to report that they are tired for fear of losing hours and/or pay. 90% of the people who have sleep problems go untreated. The two most common sleep disorders are obstructive sleep apnea and insomnia. Since sleep disorders can lead to lack of sleep or poor quality sleep, it can also contribute to occupational fatigue. To resolve this, employers should screen their employees for sleep disorders and establish programs for their treatment. Remember, 13% of all workplace injuries are caused by fatigue. Many employees tend to overestimate their condition, making them poor judges of their own health. It's important for management to actively monitor the number of consecutive hours and days worked so that enough recuperative rest can be provided. Workers may have other jobs they do not want to disclose for fear of reprisal. These jobs can also greatly contribute to fatigue. Only 20% of employees understand what occupational fatigue is. According to the NHS, 80% of employees are not aware of the causes and risks of occupational fatigue. Only 31% of workers know of the workplace factors that can lead to fatigue. Only 41% of workers believe that there should be a rest break when driving for more than 1.5 to 2 hours. 73% of workers fail to identify all the signs of drowsy driving. 89% of people fail to identify the high risks of shift work. Because of this lack of awareness on the employee's part, it is the employer's duty to educate their workers about occupational fatigue. To give you an even clearer idea about the effects of occupational fatigue, here are some other important statistics about workplace fatigue, particularly from the perspective of employers. 47% of employers have experienced productivity loss in their company due to fatigue. 50% of employers have had an employee fall asleep on the job. 57% of employers report absenteeism due to fatigue. 32% of employers report injuries and near misses due to fatigue. Like we mentioned before, it's a real problem. But since it's not going away, what can you do to help mitigate it? Companies should establish programs that help their employees maintain a good work-life balance. Steps should also be taken to improve the assessment and treatment of people with fatigue. One way to do this is to develop and introduce a fatigue risk management system, FRMS. This creates a process for monitoring, reporting, and dealing with workplace fatigue that everyone in the company can get on board with. This will take some time and effort, but it can help get everyone on the same page working toward the same goal. Safety. Reducing fatigue is a team effort. There are things employees can do and things management can do. You need to do your part.